Everyone, welcome. And for those who speak Arabic, marhaba. Thank you for joining us today for this Period Action Day 2021 session on period poverty in the Middle East, and more specifically, our panelists' experiences in Lebanon. My name is Sada Smidi, and I am a Youth Advisory Council member for Period, and I will be your host for today. Today, we will be having an engaging discussion with panelists who have lots of passion and experience in this topic. We will start by having each panelist introduce themselves. And we'll start with Lean, and then we'll move on to Sirine.
Hello, Saha. How are you? I hope you're well. Thank you for having me. So my name is Lean. I'm talking to you from Beirut. I'm the co-founder of Dawrati. Dawrati in Arabic means the menstrual cycle. It's an NGO that was founded in May 2020. I founded it with my friend Rana to actually, in the midst of the biggest financial and economic and social crisis and humanitarian crisis Lebanon is going through, we realized that most NGOs were helping people in need by distributing COVID-19 related products, food, but they tend to forget women and pads. So we decided to launch Dawrati to help end period poverty. And it's something that we do by distributing period pads and menstruation kits to girls and women in need across the country. So that's me.
Amazing. Hi, everyone. Thank you, Sarah. I'm so glad to be part of this conversation. So I work as a communication manager with an organization called Anira. It's a DC-based organization that works in the Middle East in Lebanon, Jordan, and Syria. We work with, Lebanon, Jordan, and Palestine. I'm from Syria, and I'm currently in Istanbul. We work with vulnerable communities, war-affected communities, and part of my work involves organizing campaigns and awareness campaigns. Amongst these campaigns are menstrual hygiene management awareness campaigns and promotion of personal hygiene and health practices. I'm also the founder of Shams Network. It's an initiative. We work based on social action projects, and we've distributed thousands of period pads and menstrual hygiene products in Lebanon, Syria, and Turkey.
Perfect. Thank you so much to both of you for introducing yourselves. Before we start off with our conversation, I'd like to introduce a couple statistics. That way we can paint a picture both for us and our viewers as well. So I read a report that compiled a few statistics and said that 70 to 75% of the Lebanese population needed aid due to the economic crisis and the pandemic in only July of 2021. And along that same vein, there has been a 500% increase in the prices of menstrual products in Lebanon. And as a result of that, there have been Lebanese menstruators who have debated on whether to choose to spend their money on necessities like food and then necessities like menstrual products. And with that said, we'll go ahead into that conversation, and I will ask first Lean, and then Sidine, you could follow up. What does period poverty mean to you? And of course, we talk about period poverty a lot at Period, but also along that same thought, menstrual health is such an important topic as well whenever we talk about period poverty. So if you can also address that goal as well, I would love to hear from you. So go ahead, Lean.
So first, what I want to say is that at Dawrati, we have a broad definition as to what is period poverty, because we believe that period poverty is not only the lack of the access to period pad, it's also the lack of access to a proper bathroom. It's the lack of access to information related to menstrual health and period. It's also the lack of access to a safe space where menstruator can talk about their own problem and share their own experiences. But what I want to highlight even more is that period poverty at the end of the day is actually related to ensuring women's dignity. And this is why we want to fight and end period poverty, because the woman's dignity is, we're talking about ensuring the woman's dignity. We're talking about making sure that she feels empowered enough to know that she needs to have information enough. So period poverty should not only be about accessing pads or not. And going back to the numbers that you said, and I think it's very, very important to highlight that, is that you mentioned numbers of menstruators who can no longer afford period pads or who need to choose what should be their priority. And what is very important to highlight is that vulnerability, or menstruators who became now vulnerable, is the definition of vulnerability is changing. When we started, menstruators who could no longer afford period pads or who were suffering from period poverty were women or menstruators with no income, with no jobs, coming from poor families. We had refugees, we had migrant workers, but now everything is shifting. And now you have women and girls who are educated, who have a proper job, who have a career, but because of the inflation, their salary is no longer enough. And they have to decide if they can buy menstruation products or if they have to buy food. So they need to prioritize their budget. And I think this changes the whole problematic and the whole thematic around what period poverty is now in Lebanon. And so this is something very important I wanted to highlight.
So what does period poverty mean to me? Just as you just said, Sarah, I really think, well, first of all, the ignorance around menstruation is period poverty. When a refugee woman is faced with a choice of either purchasing milk for her baby or period pads for herself, because she can't afford both, that's period poverty. When menstrual hygiene products are not included in relief and aid kits or subsidized by the state because they're not a priority, I think that's period poverty. And when women don't even know that there's such a thing as period rights or even bodily rights, that's ultimate form of period poverty. And when it comes to I've actually heard the refugee women say once, can you please stop, can you tell people to stop giving us flyers because I cannot use the flyer to stop myself from bleeding. I can't use the flyers. So yeah, I think it's a mix of everything. And the lack of this mix of knowledge and products and access and clean bathrooms, as Lean said, this is a state of severe period poverty that Lebanon and some places in the MENA region are suffering from, unfortunately.
Thank you both for answering that question. I'd like to move on to speak about our viewers. A lot of our viewers may reside in North America and Europe, and many of them may not have visited or even lived in the Middle East. How would you describe your experiences as menstruators in the Middle East?
What I wanted to focus on is that my experience is in Lebanon, okay? Lebanon, you have a pre and you have post-crisis or during crisis because we're living the crisis. Because the definition of menstrual health and period poverty changed, as I said before, pre-crisis, post-crisis. Pre-crisis, period poverty was really hitting women and household and menstruators with low income, who didn't have a proper education to know what was period, what was menstrual health. But now everything is shifting. Now, when we talk about, for example, menstrual health or period poverty, you have a lot of educated girls and women suffering from period poverty, but who are aware as to what is menstrual health. It's just that financially they cannot go and buy their pads. So I think it's important to highlight this when we want to talk about Lebanon, at least. So the type of beneficiaries or type of menstruator we're helping is different. Now we have people who usually used to go to a gynecologist, who used to ask questions about what is period, who know that they need to do regular checkups at the doctor. But now, because of the inflation, they can no longer afford their pads, so they suffer from period poverty, which was not the case before. So like she was saying, Cyrine, before there was a lot of efforts going towards raising awareness, doing education, talking to women, to girls, to menstruators about what is period, what is menstrual health. We used to do a lot of prevention. Now it's no longer the case. Like she said, they just want their pads. They don't want someone to come and tell them, so for you to be able to know what is period is blah, blah, blah. You need to know that, this and that. Women and menstruators don't want that anymore. They just want their pads, okay? Because we are going through so much. So their state of mind is really focused on living day to day, day by day. So this is what I wanted to highlight about as my experience as menstruator in Lebanon.
I feel basically like the situation in the Middle East, Lebanon, Syria, Palestine, the Middle East in general. It's very similar to many places around the globe, like India, like some countries in Africa and even South America. Access to menstrual hygiene products depends on your social economic status, unfortunately. So many of us who come from privileged families did not even think twice before buying a pack of period pads. Like it was just a given. But however, we have to acknowledge and realize that millions of girls in this region, girls and women, menstruators, it was a monthly struggle, and many of them had to resort to almost do-it-yourself DIY approaches, such as using random washable cloths, cotton cloths from undergarments, Kleenex, tissue paper, and also in general in the Middle East, there's still to this day a lack of sexual education and general awareness around menstruation. And in many places, it's still extremely taboo for it to even be discussed. It's a private matter that girls are not even supposed to mention outside their bedroom when talking to their fellow cousins or girls or relatives in the house. And this is unfortunately reality to many girls in the Middle East. Yeah.
And I want to just point out something also as menstruator, because at least what she said is right in terms of social economic status, because in the Middle East, periods are still taboo. And even in Lebanon, it's the case. But again, it depends on your social economic status, whether you come from a conservative family or not, whether you live in a conservative neighborhood or not. So for example, in Lebanon, you still find, like she said, women who don't really talk about period. If a girl goes to, let's say, a pharmacy to buy, let's say, pads, they are given to her in a black bag. Or for example, you won't see a lot of men in the family, whether it's a father, a brother, a cousin, go and buy the pads to these women. So I just wanted to focus as well on this point, because I think that people need to understand that periods are still taboo in our region. And this is why when we do awareness or when we decide we want to do a campaign, we take into account the culture we live in. You cannot be too blunt. You cannot maybe promote a lot the use of tampons, for example. At least at Dawlati, I receive tons of tampons. I just don't get the chance to distribute them to beneficiaries very easily, because it's not what girls and women or menstruator ask for. They ask for pads. So these are culturally sensitive things that also maybe people need to know about menstruation in Lebanon and in the Middle East in general.
That's perfect. And as we're speaking about how period poverty manifests in Lebanon, I would like to know if each of you are comfortable, if you can explain an experience that you had where you experienced period poverty or where you witnessed period poverty. If you could just explain and elaborate an experience that you had.
Personally, I think I'm lucky enough to have never suffered from period poverty, regardless of what period poverty is. You know, maybe unless maybe one time I had my period early, I didn't have a pad, so I had to run home with a stain on my pants. But I think this doesn't really define what period poverty is. But what we hear a lot from the people, from the menstruator, the girls, women that we are helping, we hear stories that might be shocking for people who don't really know the context in which we live in. You know, we have girls missing school. They don't go to school when they menstruate if they don't have access to period pads. They don't go out of their room. They don't shower. We have women who are missing their jobs, who don't go to work when they don't have access to pads during their menstruation. Unfortunately, these are not things I'm living, but these are the testimonials of the different girls and women that we're helping. And this is why, to go back to what I said before, basically, ending period poverty, it's all about women empowerment. It's all about her dignity and ensuring that, you know, she can be an actor of change in society if she knows that, you know, menstrual health is important and she has access to menstruation products.
Yeah, for me on a personal level, luckily I was privileged, and I was also privileged to live in a home where this is discussed and it's not taboo, and that is definitely a privilege. But to give you an example of something that I've recently witnessed, during one of the during one of the campaigns, the awareness campaigns about menstruation that we organized with Anira. This was in multiple Palestinian camps, as well as in an area called Biqa, with the Lebanese women as well as Syrian women. We've conducted like several focus groups, and we did these awareness sessions, these one-on-one sessions. We're trying to like, teach people about their own rights, their bodily rights, about menstruation and the best health practices. And we were like, women were extremely shy and extremely timid. And they even said that this is probably the first time that they ever discuss their periods with anyone else beyond like their mothers and sisters. And then we actually, we did a post on Facebook that, hi everyone, so we did this menstruation campaign and this is what we're doing and whatnot. And the negative feedback, the comments we got like, the backlash was crazy. And people were saying things like, what, this is a womanly secret, shame on you, don't you care about these women's honor and dignity? And ironically, majority of the comments were by men. So it makes you feel a bit disappointed, but it also tells you that there's so much work to be done yet. There's just a lot to be done yet, because we can't still be there, we can't still be, because without knowledge, there's not going to be any change. And without us all acknowledging that this is a natural phenomenon, it's basically a human rights, one of the most basic bodily human rights that a human must have access to and must be aware of, it's disastrous. Yeah.
But can I say something? Because at Dawlati, we have the opposite. So our biggest donors are actually men. Okay, I have actual fathers and sons coming and donating pads. We never had any backlash whatsoever, and people on the opposite are encouraging us to talk more openly about period. They believe we are very shy when it comes to talking about menstrual health, and so. See, it shows you that, in the same country, depending on where you live, the area where you live, the social economic background, you can have two different sides of the same story.
Absolutely. It's also all about access. I follow Dawlati. I'm one of the Dawlati fans, and I follow you guys. But yeah, absolutely. It's Lebanon and the MENA region in general, the demographic is just extremely versatile. And because of that, you get extremes. Exactly, you do get extremes. I'm sure people who are aware of the conversation we're having right now, who are promoting these rights, to this point are still less in terms of quantity. Yeah. And that's something we should all be working on, is how can we reach people who don't even know that period rights are a thing, or that menstrual health exists, and whatnot,
Yeah, that's wonderful. And I thank you both for your input on that question. And I'd like to change the conversation a little bit so we could talk a little bit about culture and from your experience, what do you think how do you think culture influences Middle Eastern period poverty?
Yeah, I think we just summarized it now. Depending on where you come from, your social economic background, the family you grow up in, the educational level of the person, the family, etc. I think it affects how menstruation is viewed. Also, it affects where you're living. If you are in the city compared to rural areas, conservative families for more liberal ones. But yeah, like we said, periods are still taboo. There's more and more awareness as to what is menstrual health. And I think the credit should go a lot to NGOs, because NGOs are doing, and international organizations in general, are doing the biggest work in raising awareness around that. Lebanon is receiving a lot of funds and support in this regard. But yeah, like we mentioned, so in Lebanon, so it's really the opposites. You have from liberal to conservative. So depending where you're from, either period is taboo or it's something you can discuss more freely at home.
Absolutely. Yeah, I think just like in so many places on this planet, unfortunately, like really unfortunately, culture is the narrator of the story of women's periods, especially in the Middle East. And as Lean said, yes, things are starting to change. People are talking about this more and more, about periods. But if we do dig deep into communities, it saddens me to say that too many women's menstrual hygiene rights are sidelined due to cultural, almost prehistoric shadows that are cast upon periods, unfortunately.
And also, when we talk about culture, for example, women should have a choice, or menstruators should have a choice as to what type of menstruation they need of a product they need to use, right? So, for example, in Lebanon, tampons and cups is not something that might not be given as a choice to girls, like they would say, because of your virginity, etc. So also this is a way of how culture is negatively impacting menstrual health, because women and girls and menstruators might not be given the choice to choose what they want as product because of culture.
Yeah.
Yeah, exactly. And I think just speaking also from a cultural, but also like a religious lens, as a Muslim, I know growing up, and I have several brothers who don't menstruate. So I remember growing up, you would seem almost immoral or immodest if you do speak about periods, despite it not being a religious issue, because my religion doesn't really frown upon these types of conversations, and instead it encourages that we have these conversations. But unfortunately, the religion gets misconstrued by culture, and people start to weaponize these cultural ideals to shun us from having these conversations. So I do think it's a cultural thing. It's an intergenerational issue, I believe. And along with that, speaking from your experiences as people who run organizations, who are part of organizations, nonprofits that work to fight period poverty, what do you feel are the best ways to fight period poverty in Lebanon? You can also explain to our viewers a few measures that you have taken, some programs that you guys have developed in order to fight period poverty.
Okay, so like I was saying, Lebanon is going through its worst economic crisis. Okay, and people, including myself, we are not, and women in general, are not in a state of mind where we want to listen to people talk and preach or introduce solutions like, for example, the reusable pads, etc. This is why, at least at Dawlati, we decided that the solution for period poverty should be short, medium, and long term. Okay, on the short term, what we are doing, at least at Dawlati, we are focusing all on our efforts on distributing disposable pads to menstruators in need, as well as giving the possibility, of course, for tampons, cups, reusable pads, reusable panties. So basically, it's all about distributing products to people in need. So that's our short term. In the medium term, we are working on raising awareness more generally, okay, about mental health. So it's not only about distributing pads, but slowly starting to do awareness sessions, prevention campaigns, etc., for women to be more familiar as to what is menstrual health in general. Okay, and on the long term is trying to make sure that these women are no longer reliable on donations of NGOs. Okay, so this is where maybe the focus should be on the reusable products for them to be less reliable on NGOs, okay, to empower them and ensure that they have the knowledge they need to be in control as to what is menstrual health, to be empowered, to feel that they live in dignity, etc. And for this, we have, for example, we are running different campaigns related to the different menstruation kits that we have. We have a regular menstruation kit, postpartum, and one for teenagers. So we are focusing on fundraising for that. We run awareness campaigns from time to time, but again, our focus now is really on securing funds and distributing different products to menstruators in needs across the country.
Oh, that's amazing. I'm so glad to know that this is actually happening. And I know it's happening, but it's so good to hear it from you, Lean.
Thank you.
Lovely. As for Anira, so as I said before, we work in multiple sectors, but when it comes to menstrual hygiene, what we're trying to do is we're trying to build these safety nets, these networks of women be it Lebanese or refugee women who can rely on one another. I think when women know that they are not alone in this, it definitely feels lighter, right? So when you have a WhatsApp group, let's say we've created WhatsApp groups across the country, and we're talking about women who come from, or families, menstruators, who come from really extremely vulnerable families with either no or very limited income. When these women feel that they can actually send a message, a call for action, and ask for help to these groups, the feedback we're receiving is absolutely beautiful. The fact that they can say this out loud: hello everyone, my name is, I don't know, Sirine, and I need this amount of products. So this is something we're doing through these safety nets and these networks, and through WhatsApp. We're trying to reach out to more and more women, know actually how many women are in need of menstrual hygiene products. And at the same time, we also organize shipments with international donors, medical donors, people like Johnson & Johnson, people like AmeriCares, who are actually sending menstrual hygiene products, including reusable pads, to Lebanon. And we are trying to facilitate these large shipments and try to distribute as many pads as possible. On a more personal opinion level, I think to really fight period poverty in Lebanon, not just in Lebanon, because, you know, as I said, I'm Syrian. The situation there is absurdly severe. And let's talk about also Yemen and all the Arab countries where this is an issue that should be addressed ASAP for community health and for the menstruators themselves. I think education is key here, and introducing topics at an early age at schools to all genders is a very good precautionary solution. I also think that we need to do a lot more advocacy work that ignites conversations on a strategic and more policy level. This is very much needed in the MENA region, and it's the only way to ensure effective, long-lasting measures. I really think, and this conversation is an example of them, and Lean's work is an example of this, is that we really need to foster direct linkages and establish partnerships between grassroots organizations in Lebanon, people who are from the community, who are working with these communities, and big organizations such as Period, for the sake of capacity building and for access sake also. And so they can be heard, and we can all come up with solutions together. And I think we need to all work on normalizing talking about periods, because the more we talk about something, little by little, we can actually all collectively start changing the narrative, and that's the only way this will eventually be resolved. Just normalize this.
Exactly. And I wanted to just mention something. I don't know if you realize, Sarah, we didn't even mention introducing and removing the tampon tax in Lebanon, because we are going in such a big crisis. We don't even think that it's not even the government's priority, you know, menstrual health in general. And so, but like she said, Sirine, advocacy is very important, lobbying efforts, but it's very difficult to do so. I know that it's a strategy that a lot of developed countries has taken to ensure that period pads and different products are not taxable, that they are available in schools and universities, etc. Unfortunately, for us, at least this is my personal opinion, for Lebanon, for the short, medium, and even long term, it's not something that can be achieved. But I agree with Sirine, and I like the fact that they do a lot of peer-to-peer, because I believe that it's the best way to normalize the conversation actually about period.
But Lena, I think you should stay hopeful, and I think we should, I take this moment to salute and say cheers to Sudan and all the Sudanese activists for recently. Yeah. What's happening in Sudan, and this is quite a milestone, and it's quite a milestone, and I think we're gonna all get there, and as long as we're having conversations like this one, we'll eventually all get there. And I'm so proud of the Lebanese. I'm proud of the Lebanese, of course, always. But I'm so proud of the Sudanese activists that kept pushing and reached that, the policy level. Absolutely, yeah, amazing.
And Sirine, do you mind explaining to our viewers what happened in Sudan for anybody that's not familiar?
So now in Sudan, women have access to free of charge period pads, and it's become a given. and it's acknowledged as a basic human right. And I'm so happy that this is happening, and it gives me hope for all the other Arab countries and all Arab women and women in general around the world, because once the thought is ignited, once the thing is out there, it's just the ball is gonna keep rolling. And I hope we all learn from Sudan and from each other.
Yeah, definitely. I agree with you both. And I think this is very inspiring. And speaking about, like Lean said, lobbying efforts that gets you to legislative change or governmental change, but also what's probably more important than that and gets you to a long-term goal is the power shifting. So really taking power from international organizations, from big organizations, shifting it to the community that actually needs help, centering their voices is so important in this effort to fight period poverty. And a call to action for everybody that's watching, for us three, I think it's important for number one, for us to prepare. So doing your research, trying to get educated about period poverty, right? Speaking to menstruators, right? The second one is the advocacy that both of you just touched on. So whether that's on social media, as a lot of us have been doing because of the pandemic and everything being virtual, but also having conversations with your friends, with your family, with your community members. And overall, if you get to that point, going to the people that are in office. For us here in the US, we have our senators, we have our governors, we have our state representatives, right? For in Lebanon, it's a little bit different, but there's still people in power that can be reached and that can make a change, right? And the third step in this call to action is donating your time and money. So finding organizations like Period, like Dorati, like Anita, that are supporting grassroots activists like you both have mentioned, and are doing amazing work to trying to dispel myths around periods, trying to educate menstruators and supporting young menstruators of color specifically. I think all these organizations are doing fabulous work in this effort to fight period poverty. And along with that, if any of you have anything to add about how people can move on after listening to this conversation, what should they do in their own community?
Yeah, I think that when it comes to period poverty, this is what we say at Dorati, we can, bring back women's dignity one pad at a time. So, one pad, it changes a lot in a woman's life, in a menstruator's life. So, and for Lebanon, now we have a shortage of everything, of medication, of baby formula. Don't forget pads. For those who can donate, really, there are so many organizations that are working on period poverty. So when you are thinking about donating to people in need in Lebanon, think about period pads as well.
Yeah, absolutely. I would encourage people to look up Dorati and donate to these organizations that are directly working with people. You can also check out our work at Anira and help us by donating. I think most importantly is, and especially for our Arab viewers, I think we should talk about this more. Don't be shy. Share periods content, share Dorati's content, be loud about it. Don't be shy about it, because this shyness is what's going to keep us moving backwards, or
talking just about period poverty.
Yes, just exactly. So just talk about it and don't be shy, even if you feel that people are going to judge you or misunderstand you or think less of you for some reason. Your duty is to acknowledge the fact that this is a basic human right, and we all need to be part of this conversation, whether we're working in NGOs or not, whether we're students, whether we're doing whatever. This matter does concern all of us.
That's wonderful. And I think those calls to actions are perfect. And I want to close off by saying thank you so much to Sidine from Anita and Lean from Dorati for all your efforts. Ya'tikum al-afia in Arabi.
Thank you for having us.
Yeah, I really appreciate everything that you guys are doing in this space, in this menstrual equity space, and all the work that your organizations have been doing. So thank you so much to our viewers for watching this conversation about period poverty in the Middle East, and I'll catch you guys later. Bye.
Thank you. Bye.
Thank you. Bye.